I think what's important related to transmission is what we know. Importantly, what we don't know.
When clarifying previous remarks about transmission, the WHO said it can be transmitted by people without symptoms, citing some models which estimate as much as 40% of transmission comes from asymptomatic spread.
We had both a statement which was incomplete and headlines which took it and ran with it, and when in fact nothing has changed in terms of our understanding about how this virus can spread.
Josh Michaud is Associate Director of Global Health Policy at the Kaiser Family Foundation.
We know that people who don't have symptoms can transmit this virus to some extent. What we don't know is to what extent that is.
A study from CDC scientists says evidence supports transmission by people not showing symptoms. But there's a difference between asymptomatic and pre-symptomatic. Asymptomatic carriers never show symptoms, while pre-symptomatic carriers don't have symptoms yet. A study published in April estimated 44% of infections came from people who were pre-symptomatic.
It might be easier to think of this as people who are unaware that they're infected. That almost certainly accounts for a significant proportion of people of new infections.
That is why, despite all the unknowns, people in public health recommend wearing masks and stress social distancing. Jennifer Austin, KARE 11 News.